Welcome everybody. If you did not make it to the Friday Huddle earlier, for those who are coming from the Friday Huddle, it was a great conversation. Thanks for that. And for those who are now joining us for our extended cut, really excited to see you. Thank you for being here today. As just a quick introduction, my name is Jana Bitton. I'm with the Oregon Center for Nursing, and I'm really proud and happy to introduce Dr. Rick Allgeier, who is going to be speaking about our latest report that we put out looking at the trends of the nursing workforce over the past 2 years. So without further ado, I'm going to just turn it over to Rick and let him take everything so that we will get out of here in a good amount of time and allow you to ask questions too. So Rick, take it away.
All right, cool. Thank you, Jana. Let me get this bad boy going. Okay, can everybody see that? Cool. All right. Good morning. Thank you for joining us this morning so we can talk about the latest report we just put out. About every couple of years, we want to take a step back and just look at the workforce in general to kind of see how it's doing. And so this is a report we just put out talking about the workforce from 2022 to 2024. So we're looking at about a 3-year period. And I'm just going to jump right in. Hang on, let me see if I can. There you go. Okay, so this data right now, so basically what we're looking at is the first thing we look at is just to see how the workforces are growing. And this is the statewide supply of registered nurses, and it is definitely growing, about 2% a year. And practicing RNs are growing by about a point and a half, 1.6%. And the difference is
We lost him.
Yeah, it looks like Rick just froze, so we're going to give him a minute to come back. All right, did he come back? Yeah, Rick, you're back.
okay, thank you. Yeah, I've got wonderful internet up here. Anyway, so we also look at the number of nurses, RNs that are practicing in the state, and we make an estimate of that because as nurses who, when they relicense, know that they have to go through an OHA survey, and that's where we get most of our data. The problem is we don't know what happens to people who just got licensed. We don't see this demographic and practice status data until your first renewal. So we have to make an estimate on the number of people, the number of newly licensed nurses that are actually practicing within the state of Oregon. Since 2022, we added about almost 3,000, just under 3,000 new licensed RNs and about 1,800 practicing RNs. So we're growing. When you compare it to the state population grew last year about 0.4%. So we're seeing more licensed nurses, quite a bit more licensed nurses in the state is growing. So statewide supply of nurse practitioners is really growing. Annual growth is about 15%, which is really, really high. Practicing practicing NPs aren't quite as high, but it's still at 12.3% growth per year, which is very, very high. We've added a little over 2,100 licensed and 1,300, almost 1,400 practicing NPs in over the study period, these 3 years. Where are we getting the nurses? Well, for registered nurses, most of them continue to come to Oregon through migration. A substantial share are entering the Oregon workforce via endorsement. Over the past couple of years, 5 years, 73% of licensed RNs are obtaining their licenses through endorsement. For every newly licensed RN, 2.7 RNs are coming from out of state. When we look at practicing nurses, for every newly practicing RN that's educated in Oregon, we're bringing 1.5 RNs from out of state. The graph says that we've seen this since 2016, which is true based on this cohort of data. But in reality, Jan and I have been seeing this since I started, which was in 2016. We were looking back at 2013 when this started. We did think that this would start tapering off a little bit. But as you can see, It has not. It is still growing at a very, very fast rate. And why is that important? It's like, well, because we are trying to look at the number of nurses that are practicing in Oregon compared to the Oregon Employment Department that does their annual occupation projections. And so they give us a projected idea about what the state's going to need. Statewide, this isn't necessarily a regional issue, it's a state issue. And we are seeing about 29 to 20, 28 to 2,900 nurses that we need every year. According to the data that we have from the OHA Workforce Reporting Program, we are actually bringing in somewhere between 58 and between around 5,000 to 5,800 nurses every year. So we are almost doubling the projected need from what OED projects we need. Now, because we are exceeding that projected annual statewide need, this does not imply that every employer can recruit easily. What it does mean is that talking about a statewide shortage is really an oversimplification of what's actually happening across the state and in different locations within the state. It is very likely or very possible for a statewide adequacy to coexist with persistent local workforce strains. Now, why is this important? It's like because if you have a true statewide shortage, you adopt certain strategies to address that shortage. And usually that entails upping enrollment in nursing school and those kinds of activities. But if we engage in those activities now, while we do need to attend to nursing education in the state of Oregon, we need to make sure that we are producing enough nurses. If we put all of our eggs in that basket, we're really falling short on what actual solutions would help. So why are we running into this issue? So we're really basically trying to get people to stop talking about a statewide.
And it looks like, is anybody else hearing Dr. Allgaier? Nope.
No.
Okay. Okay.
Okay.
There, you're back. All right, try again.
Okay. It's funny because every time I come back, and then my computer tells me my internet connection's unstable. Anyway, so basically what we're trying to do is we're trying to get people to quit talking about a statewide shortage because it's evident through the data that we have an adequate number of nurses across the state. They may not be in particular areas or in different practice settings. One good point that we've seen in the data from 22 to 24 is there's no evidence of an imminent wave of retirements. I still see it in the media some about the aging of the workforce and that the nurses are going to be retiring in great numbers. We think that happened to us. So the data here shows two different graphs. The top graph looks at the age distribution from 22 to 24. And as you can see, one is at basically past 50 years of age. You don't see a rapid decline. It's a gradual fall off. Whereas the graph below for 2012 to 2018, you really saw a very steep decline in the number of nurses that were practicing in Oregon. And so we think that we saw what they call the silver tsunami or the retirement cliff. We think for Oregon that happened in the 2010s. Which is not like others. Not every state is experiencing the same kinds of things we are. We are still hearing about states talking about concerns of imminent mass retirements. We are not. We've been seeing our workforce, and you can see in the bottom graph that the workforce has transitioned to a younger workforce since basically 2014 or 2016. And right now it's a very nice balanced multi-generational workforce. And the reason that this is important is because that balanced workforce supports continuous knowledge transfers from experienced nurses to early career RNs. So that's really important that we have the base nursing workforce is it's a multi-generational, which means it's fairly age stable, that we're not going to be losing large troves of nurses to retirement anytime soon. Now, but the issue is we have a distribution issue. So nurses exist, but they're not evenly distributed, which we call which is called maldistribution. And we've been talking about maldistribution since 2019 when we put out a paper that specifically looked at this issue. And since then, we've done a lot of work following up on maldistribution, showing that it is indeed geographic. There's geographic isolation. We were talking about John Day during the Friday Huddle this morning. And of course, that's a good example because they are a very rural setting. They're far away from other cities. I guess Ontario is probably one of the closest or Baker City, maybe. So they're really pretty isolated, and it's hard to get sometimes it's hard to get issues or nurses to move into those areas. There's also some practice setting preference. Practice setting preferences also drive another form of maldistribution. So hiring difficulties can persist in rural areas and in non-hospital settings, even when the state has adequate supply of practicing nurses. So what this is suggesting to us is that there's a strategy shift that needs to occur. And those new strategies basically from our perspective, take four different tracks. One is retain nurses that are already in the workforce. And as we have been talking over the past 4 years, we're talking about culture of the workplace, job quality and workload as central to for workers to stay in the workplace that they are currently in. We also need to be targeting care settings with greatest strengths, which is focusing on rural communities and long-term care and other non-hospital based care settings. The last one is tougher, but it's something that we really need to be focusing on because as we've done work looking at maldistribution, especially geographic maldistribution, you need to be thinking about place-based solutions. We have found that the barriers to getting nurses into rural communities have sometimes very little to do with the employer or very little to do with the healthcare infrastructure within that community. It's things like housing. It's do spouses or partners of nurses have economic opportunities? Is there a place for them to work? Schools and things to do within the community are sometimes big barriers to getting people to come live and work in your community. The last one is actually utilize the age profile that we're seeing as an opportunity. Since we have this multi-generational workforce, you can invest in mentorships and flexible roles that can keep experienced nurses engaged while supporting the knowledge transfer to their younger colleagues. So those are kinds of strategies that we should be looking at to solve the pressures and issues that smaller communities, that the employers in smaller communities are facing with their efforts to recruit and hire, and to some degree retain their nursing workforces. Wow, I got through that quickly. The Oregon challenge is not simply too few nurses. It's whether nurses are in the right places and whether the work environment and community conditions make them want to stay. So this suggests, as we've been talking about and the data also support, is that we have an ample number of nurses statewide. They are not distributed evenly across the state. And so some communities have a tougher time than other communities in terms of recruiting and hiring an adequate supply of nurses for their healthcare systems. And then we also notice that turnover tends to be pretty darn high. We're looking at data that suggests within the first year, about 30% of RNs leave that first job. And because resources are very tight, it is tough to it's tough to get enough nurses educated, but if we allow 30% of them to leave within the first year or two, that seems to be not the optimal use of those resources. So it's not that we don't have enough, it's that they're not in the right places, and we just need to ensure that our work environments and community conditions make them want to stay. Does anybody have any questions on this?
Thanks, Rick. So if you do have a question, you can unmute and ask it or raise your hand and we'll call on you. Otherwise, the chat is available to ask any questions for follow-up or just general inquiry. Rick, Tom did ask 2 questions in the chat, but he also raised his hand. So Tom, why don't you go ahead and
Yeah,
I'll
go
call
ahead,
on you.
Tom.
Rick, I understand that something like 20% of the people who sit for the NCLEX are foreign educated nurses, or foreign trained, I should say. And I don't I only look at the US data on that. And I don't know to what extent that's a phenomenon in Oregon, to what extent it influences the reports you're talking about.
Hmm.
Um, are those nurses automatically urbanized, or that's one question. And then the second question is I think I know that in Oregon, urbanization since 1950 it's like it's huge. It's like 20 to 40%. And it's like 80% now people live in urban areas. So I don't know to what extent that influences your recommendations, what to do. It seems like a pretty tough problem if everybody wants to move to the cities.
Well, it is an issue, Tom. I mean, that's part of the issue is that the state has become very urbanized, and getting people to move into the rural parts of the state. I mean, Don and I spent a week in Coos Bay talking to all types of employers, hospital, long-term care, school health, ambulatory care, and they basically all were talking about the same kinds of issues. Is there's a lack of housing, um, or if there is housing, the housing's unlivable. School districts are, in some instances, great, in some instances, not so good. So those are decisions people are using to decide if they want to move to a community or not. There's also things to do within the community. Restaurants, things to do on your off hours also has a big factor in whether people move to some of these smaller communities. So it is a big issue. And as people urbanize, some of the smaller towns get smaller. Um, the one upshot for that is, and we heard this from all kinds of employers across the state, is that if you're talking to nurses about trying to recruit them, if they're outdoorsy, like to hunt or fish or do some of those outdoor activities, we have tons of that stuff here. The folks yeah, we've heard that from a lot of different places, that those kinds of folks are very attracted to some of the rural communities just for the outdoor opportunities that are available. In terms of true, in terms of the foreign trained or foreign educated nurses, it's not much of an issue here. The last time we had data, it was hundreds, not thousands. It was hundreds of nurses who came to Oregon from other countries. So it's a pretty small percent of our population here. Okay.
Thanks,
This is
Tom.
Chris. Can you hear me okay?
Yeah,
Yes.
Chris, go ahead.
Just out of curiosity, and this might be too in the weeds. I might be overthinking it. Not that I ever overthink anything, but
Yeah, join the club with that.
from the nurse perspective, prospective employee mindset, if the situation is that the rural locations have a tricky time recruiting and retaining nurses, and primarily the traction is the urban areas, does it then follow that there are a bunch of nurses that can't find work where they want to be because everyone's competing for the same jobs? And so nurses come here and they find themselves not being able to get work where they want to get work. And so what do they do? Assuming I'm drawing a correct conclusion. They don't want to go to a rural area. They can't get a job where they want to be. Do they leave? Do they just not go into nursing after? Like, what's the practical implication for the prospective employee in that scenario, I guess?
Yeah, so we are hearing that especially in the Portland area and in hospitals in the Portland area, they're being very selective and and we're hearing this anecdotal. I haven't seen hard data to support this, but we're hearing it quite a bit anecdotally that jobs are harder to come by, that people aren't able to work in the emergency room at one of the Providence hospitals or whatever in the Portland area.
Yeah.
And so back in the day, when hospitals were being fairly selective on hiring, they would often require experience, and so nurses
Yeah.
would go off to a long-term care or another setting to get a couple years experience and go back into the hospital setting. What we're
Yeah.
hearing now is that a lot of the local hospital, a lot of the urban hospitals are requiring a residency program
Okay.
to go
Yeah.
through. What happens if we don't? I mean, and this is part of the issue where we start falling off with the knowledge that we have. So if they aren't able to get a hospital job in an urban community, we're not really quite sure where they end up going because our data doesn't talk about where they're employed. It just talks about licensing stuff. And so we kind
Mhm.
of lose track of where they're at in terms of a specific practice setting. We know
Yeah.
what type of setting they're in, but we don't know exactly where they're working. Um,
Yeah.
we just don't know. It's a very interesting question, and we would really love to know where nurses that are unsuccessful in getting into a hospital in their first try, where they end up going. I don't know.
Yeah. Okay. That's helpful insight. And I know that there
But
are
we know it's
layers
an
to it.
issue. We also know that the urban communities are a little bit more selective. Unfortunately, I think the pandemic had some impacts on this. Don and I were talking to a long-term care community, and they were telling us that prior to the pandemic, that they got a pretty steady influx of new RNs.
Mm.
Would go through their facility to get some experience before they moved on. And then when the
Yeah.
pandemic happened and the hospitals just started hiring people straight out of nursing school,
Yeah.
they claimed that at that nursing facility that their supply of that supply of new nurses has kind of dried up, and
Yeah.
so they were
Yeah.
struggling. They were struggling to hire as well.
Gotcha. That's helpful to know. And my scenario, and I'm asking partly
Hmm.
as I think ahead the next couple of years. So just Reader's Digest version.
Sure.
I'm not an RN right now, but I have worked in healthcare in various capacities for a couple decades, hoping to get into a nursing program within the next 8 months or so. Probably will do follow-on nurse practitioner training afterwards. And so I'm
Okay.
not really, I'm in my 40s. I'm not like I want to go work 12 hours on a shift 3 days a week kind of thing. I'm past that. I've been there,
Right.
done
Right.
that sort of
Right.
thing. So I'm thinking more, outpatient setting, maybe primary care or something, but not necessarily looking for a huge hospital facility type gig either, and open to community-based type stuff more so.
Hmm.
And even willing to maybe travel. So I guess what I'm trying to think about is my experience and then my goals and then the job market, what that could look like, and partly where's the need. Obviously, where's the
Hmm.
need is a big question because I really like when I work, I want my work to matter. It's not just about having a job. I
Yeah,
want to make a difference, and which I think
absolutely.
people go into nursing to do that, right? They want to
Yeah.
take care of people. But it's an interesting dynamic because yeah, like
Hmm.
you all are sharing with the data, it's like, well, okay, but I want to enjoy where I live too, right? Like that's part of
Yeah.
the
Yeah.
deal.
Absolutely.
And so it's tricky to think about how to meet those needs and have
Hmm.
quality of life at the same time.
Right, right. Now, I think the maldistribution data does suggest that we have a geographic maldistribution. We've also shown that we have a practice setting maldistribution where folks are preferring to work in specific settings over others. But we are hearing that you know community-based care settings, long-term care-based settings, even in urban even in like in the Portland area are still hiring. They're still looking for folks.
Sure.
So those are definitely opportunities. We have heard, and again, it's anecdotally that it is the hospitals are tightening up some and being more selective in who they hire.
Yeah. Okay. Well, thank you. Thanks for your insight.
You're
I'll
welcome.
mute myself. I think other folks might want to chime in.
Mhm.
Thank you, Chris. Rick, I'm going to read some of the
Sure.
comments in the chat just because they pile off onto this nicely, that conversation you just had. If you want to take a look at George's question to answer that after I'm done, we can go there. But some of the comments that were in the chat were that students are finding it more competitive in the
Yeah.
metro areas. And so they are looking at taking on skilled nursing facilities and other community-based care settings to get that experience while those openings are limited. And Casey, Andrew had said that rural communities and nursing workforce also applies to the teaching workforce. So making that relevant to other practice
Mhm.
settings beyond acute care and emphasize that training in place, training in local areas where their actual need is probably the best solution to continue to
Correct.
grow those workforces.
Yeah, and we agree with that. The downside for that is nursing schools are resource heavy. They demand a lot of resources, and you can't have you just it, financially it would just be very difficult to have nursing schools everywhere. Um, we do have them pretty spread, but there are like parts of the southeast part of the state. There's really nothing out there once you get east of Klamath Falls. So there are basically we know there are educational deserts out there. Um, and we know that growing your own works, because if you come to Portland for school, you may be more likely to want to stay. So we do understand that.
All right. And then to George's question was, people are going to work where their specialty is. Clinical sites are competitive. Is there any
Mhm.
evidence that education is shifting towards task-based acute nursing?
Um, I'm looking at it again. Um, George, I don't know.
Uh,
You'll have to talk to an educator. We're hearing that they're trying to train more generalists at a bachelor's degree. And so the specialization is being gleaned or gained through residency programs and those kinds of things. Um, and with the NCLEX test and those requirements, I think it's putting some constraints on what nursing programs actually have time to do.
I meant to say shifting away, but thanks, Rick. I appreciate it.
Mhm.
Yeah, I think just to put my personal interpretation on that, George, is that exactly what Rick said is that we do train generalists. So unlike other pathways where you can take specialties
Mhm.
within your education trajectory, I don't know that that's yet available in nursing.
Yeah. And Tom, we see your hand raised.
George, Rick, excuse me,
Yeah.
I'm always struck by that graph that you've showed before, and in this report, the difference between the licensed nurses and the practicing nurses, and
Okay.
I totally believe it, but I always leave these discussions sort of wondering who those 20,000 nurses are, what do they have for breakfast, and what is their, what is
This,
that about? And it really is a
yeah,
huge number, and it always makes me sort of step back and
yeah. And here's the best example of what's going on, Tom. It's the nurse. So we have a lot of nurses that endorse into the state, as you can see on this slide.
yeah,
But of all those nurses that endorse into the state, about 40% of them actually work in Oregon. So we have 60% of these nurses that have nothing, that don't do anything here, or they've come in for um, as travel nurses or for temporary assignments as needed, and then once those assignments go are no longer needed, they will not renew their license. But that 40% is enough to give us enough nurses that we actually surpass our estimated need every year. So I think a lot of those that the gap between what we see in how's this? The gap between what we see in terms of license includes a lot of folks that don't work here. And it's because employers require licensure because of they either work for an insurance company. And we also have a lot of people who work in Idaho, California, and Washington that are required to get an Oregon license on the off chance that they would serve an Oregon resident.
But Rick, if I
Mhm.
were a politician thinking about financing healthcare or financing even nursing education or health education, and that graph was sort of shown to me, and I don't doubt the accuracy of it, and I think your explanations are right on, I would say to myself, well, it seems like there's a lot of people out there to do a lot of things, and something's fuzzy, and it really is striking that there's that many nurses that fall into the groups you just described, I think.
Mm-hmm.
It really,
Yeah, I mean, and when we
let me
and
ask
we
a follow-up question.
sure.
If other states were doing the same graph, would it kind of look the same for them too?
Unfortunately, I have no idea because once you
Okay.
join the compact, you lose the ability to track nurses that are coming from out of state.
But the state report for Wyoming or Louisiana or wherever might show the same phenomena.
Might
We don't know. Okay.
Right. Well, I mean, in reality, there's some things. Oregon's very attractive to nurses. So one of the things is we are one of the top 3 or 4 payers.
Okay.
Nurses make a lot more money in Oregon than they make in other states. There's
Okay.
also a lot of livability or issues. The staffing law. People know about the staffing law, so that is an attractor. And Oregon's a very pretty state to live in, and I think that's also as an attractor to folks. So I'm not sure what it would look like when we talk to our colleagues, like at the National Forum, which is made up of other centers like us in different parts of the country. They don't talk about their endorsement nurses like we do.
Oh,
So
okay.
so I think we might be without any data. This is just supposition, but I think we're probably somewhat unique.
Okay. Thank you. Thank you
Yeah.
much, Rick. Thanks. Good stuff.
Oh, thank you, Dom.
All right, and we are at time, actually over. So
Yeah, yeah,
thank you everyone for your questions. If you have any additional questions, feel free to contact us, connect with Rick, and we're
yeah,
happy to field those and provide the presentation elsewhere if there is a need. So thank you for
absolutely. So,
coming with us today and hope you enjoy the rest of your day.
yeah, thank you all very much.